we are being extremely vigilant in this scenario. The Rhode Island Department of Health has been preparing for weeks to ensure that we have a structure in place to the best of our ability, limit or prevent the spread of COVID-19 in Rhode Island. We fully anticipated standing before you at some point to make the announcement we are making today. We are not seeing widespread community transmission in Rhode Island. And that means the general level of risk for Rhode Islanders is still low. Another important thing to know is that the risk level is very low for someone who is a contact of a contact. That's also an important message. At the same time, I want to echo what Governor Raimondo has said. Everyone can assist us in working to prevent the spread of viruses like COVID-19 as well as the flu, which we know is circulating. Washing your hands is critical. Washing your hands multiple times throughout the day works well, using warm soap and water, and if soap and water are not available, using alcohol-based hand gel. And also, an important message, please, if you are feeling sick, stay home from work or school. We have been working to communicate to businesses and schools how important this message is so that everyone can be supported in being able to do that. I want to reiterate it now so that everyone can hear. If you're not feeling well, just stay home. That's in advance of running to a healthcare facility. If you feel like you're okay to stay home when you're not feeling well, that is the best place for you to be. Coughing and sneezing into your arm or tissue is also critical. If you've not received your flu shot, this is an opportunity to do that as well. Not because the flu shot protects against COVID-19, but the flu shot helps decrease your risk of needing to go to the hospital with the flu if you develop severe symptoms. The flu shot is also helpful for protecting the people who are around you against the flu. We need to keep everyone as healthy as possible. Another key reminder is that masks are not recommended for people in the general public who are healthy. Wearing a mask is primarily reserved for a healthcare provider or someone who has symptoms and if they are ill. Masks are usually to prevent the spread of illness that already exists. Someone who is well, the CDC does not say that there is any benefit in wearing a mask. And a key component is we want to be able to preserve masks to make sure that they are available for the healthcare providers who will need them. Finally, it's very important that people know when to go to a hospital emergency department and when not to. Generally speaking, many types of illnesses and injuries do not require an emergency department visit. Going to an emergency department for an illness or injury that could be treated by monitoring yourself at home or communicating with your primary care provider will be important to understand. If you just go to the emergency room when it could be handled in other settings, it will likely just result in an extended wait time at the emergency department. So we want to make sure people have the support needed to stay home if they are showing symptoms and ill and do not feel like it's severe enough to require an emergency department visit. There are quicker and less expensive treatment options that are available for people if they are ill.